Welcome back guys. Now in this video, let's discuss about bile. Now bile is produced by liver, and every day how much bile is getting produced? Every day almost 500 ml. That's a half liter of bile is produced every day. Okay, and bile consists of what? See, bile consists of bile acids, bile salts, bile pigments, cholesterol, water and electrolytes. Remember one point, most of the bile is nothing but the cholesterol. Okay, cholesterol is forming the bile. Okay, just have this in mind, later you will understand why I am saying that. See, bile acids, bile salts, all these are coming from the cholesterol only. You will study about this bile acids, bile salt in detail in your biochemistry. Okay, bile acid, bile salt, not a big difference. If onto a bile acid, if one sodium is going and sitting, it's called as a bile salt. Okay, you are adding salts. Okay, so it become bile acid will become bile salts. But at the end of the day, they are coming out of cholesterol derivatives. Okay, now, so this bile is produced from where? Bile is produced from liver, and where it is getting stored? Bile is stored and concentrated in a small pouch, in a small bag called as gallbladder. So gallbladder, okay, stores and concentrates the bile. Remember, if someone asks you, bile helps in digestion? Yes, it helps in digestion. It helps in digestion of what? It helps in digestion of fats. But bile by itself doesn't contain any enzyme. Okay, bile does not have any enzymes for the digestion of fats, but it do something which will help in digestion of the fats. Okay, bile have no digestive enzymes. No digestive enzymes are there. Okay, but bile helps in digestion by the process called as emulsification. We will discuss about this emulsification in a minute. See, what exactly is this emulsification? See here, emulsification. If I ask you what exactly is emulsification? Emulsification means, see, here is a large flat globule. Okay, here is a large fat globule. Okay, it's very big. Okay, now this lipases cannot directly act on this fat globule. It's a very large. Okay, it's a very large thing. Now, what we need to do, we need to convert this large fat globule into small globules, small things. So, this bile, here is a bile salt. Okay, now here is this bile salt. Now, what this bile salt is doing? Bile salt is going to make this big fat globule into small pieces. Okay, this bile salt is going to chop. It's going to chop the big fat globule into small pieces. So, this process of conversion of a big fat globule into small droplets is called as emulsification. So, bile converts large lipid molecules into small droplets. This is called as emulsification. Once the lipid molecule becomes into small droplets, now that can be easily digested. Okay, these molecules now can be easily digested away. So, bile also play an important role. Okay, now this is one function. Digestion of the fats is done. Now, bile also play an important role in excretion of bile pigments. What are the bile pigments? Bile pigments are bilirubin, bilirubin and biliverdin are the bile pigments. Now, these bile pigments, okay, bilirubin and biliverdin, they are produced due to heme metabolism. They are produced due to what? Heme metabolism. So, what exactly is this heme metabolism? For every 1 to 2 days, RBCs are going to be damaged. Okay, RBCs are going to be destroyed in the spleen. Destruction of RBC will release hemoglobin. That hemoglobin will be again recycled. Okay, the protoporphyrin in the hemoglobin is going to be metabolized into these pigments like bilirubin and biliverdin. So, bilirubin and biliverdin at the end of the day, they are nothing but the metabolite products of heme metabolism. Okay, they are the products of heme metabolism, and they will also be excreted out of the body through the bile. Okay, through the bile. Now, let's see here. Here is your liver. Okay, here is a liver. Now, from the liver, see, these are the bile ducts. Okay, these are the bile ducts which are coming out. Now, see, here is a gallbladder. Here is a gallbladder. Now, bile is stored and concentrated. Here, the bile is stored and concentrated in the gallbladder. Okay, very good. Now, important point is, see, now this bile, whenever is needed. Okay, whenever is needed. Well, for example, think like this. When cholecystokinin comes, now this cholecystokinin is going to act on the gallbladder, cause the contraction of the gallbladder. Now, the contraction of the gallbladder is going to release the bile. Now, see here is the bile. Now, here is the bile. Now, what this bile will do? It will cause emulsification of fats, helps in digestion of the fats. Its function is done. Okay, its function is done. Now, all these bile salts, see, now all these bile salts, they are derived out of cholesterol. Okay, they are derived out of cholesterol. Now, they are highly energy substances, right? We can't simply throw them out. Okay, you cannot simply throw all these cholesterols out of the body every day. You cannot make again and again. You can't make the bile salts every day new. Okay, you can't do that. You can't afford that. So, what happens is, all these bile salts, okay, all these bile salts, when it comes to the terminal ileum, they will be again reabsorbed back. Okay, they will be again reabsorbed back into the portal system. Okay, these are the portal veins. Now, in the terminal ileum, all these bile salts, most of the bile salts I should say, most of the bile salts will be reabsorbed. Now, all these bile salts, where they are coming, see, now via this portal vein, hepatic portal vein, they are coming back into, they are transported back into the liver. So, this is called as entero. This is the ileum is a intestine, right? So, entero. Liver is hepatic. So enterohepatic reuptake is happening. So bile salts are reabsorbed back into the liver via enterohepatic circulation. Okay, this is something normal. But what is the important point I want you to know is the pharma link. Sir, how can we take this concept? Okay, how can we put this concept in treatment of hypercholesterolemias? See, hypercholesterolemias means the patient is having high levels of cholesterol in the body. Okay, dyslipidemias. Now, if you want to decrease the cholesterol levels in their body, okay, if you want to decrease the cholesterol levels, what you can do? If you inhibit this process, okay, now just give a drug. Think like, now you give a drug. Now what the drug is doing? Now that drug, it will come and it will bind with the bile salts. Now what happens? Now because of the presence of this drug, now this enterohepatic reuptake is inhibited. So now what happens? All these bile salts are going to lost in the feces. So cholesterol is going out in the feces. So every day the cholesterol which is stored in the body, now that will be used up for the formation of new bile. So cholesterol stores are getting consumed away. So now what are these drugs called as? These drugs called as bile acid. Okay, this drug will go and bind with the bile acid. So bile acid binding agent, BABA drugs. Okay, so these drugs are called as BABA drugs because bile acids are being bind. Okay, so what are these drugs? Bile acids. See, bile acids are reabsorbed into the body via enterohepatic circulation. So enterohepatic circulation is going to help in reabsorption of the bile. Okay, now what are these bile acid binding agents? The bile acid binding agents include, okay, cholestyramine, cholestyramine, and 𝐒𝐲𝐶. Cholestyramine, cholestyramine and 𝐒𝐲𝐶, these are the drugs which are helping in excretion of the bile salts from the body. Okay, excretion of the bile salts from the body is going to be done with these drugs which are called as the BABA drugs. Okay, so these drugs are used in treatment of dyslipidemias. Okay, now here itself I just want you to know some important terminologies which are the cholegogues and cholerectics. So what exactly are these cholegogues? Cholegog is any substance which causes the contraction of gallbladder. Okay, cholegog is a substance which causes the contraction of the gallbladder, helps in bile release. So what is that substance? Cholecystokinin. So cholecystokinin is a cholegog. Okay, and what are cholerectics? Cholerectics are the substances which increases the production of bile. Okay, for example, bile salts, secretin and parasympathetic nervous system, they all help in secretion of the bile. Okay, they all help in the production of the bile. So cholerectic and cholegog, I want you to know what is a cholegog. Cholegog is the one which causes the contraction of gallbladder and helps in releasing of the bile. Okay guys, hope the topic is helpful. Okay, we are done with the bile. In the next video, we will discuss about the intestinal secretions and gastrointestinal motility. Thank you.